All right, everyone. Thank you so much for joining us. It is fall semester. Yesterday was the start of fall for Charles R. Drew University of Medicine and Science. So you already know what time it is. It's time to come into the Lion's Den once again. And I am your moderator, Dr. Ashanti Carter, and I serve as the Director of Community College Partnerships here at CDU. So, my guests today, they're amazing. They're with one of our partners, Cedars-Sinai. Let's give them a round of applause.
Thank you.
So let's jump into it. I'm going to start with you, Dr. Cho. Give us your name. Talk to us a little bit about what you do at Cedars.
Thanks, Dr. Carter. Really excited to be here, everyone. Good evening. My absolute pleasure joining you today and talking about vaccinations. I actually serve as medical director for Coach for Kids. It stands for Community Outreach Assistance for Children's Health. And we provide mobile medical care in underserved communities, mainly in South Los Angeles. So we go to dozens of sites in South LA, and we provide essential primary care services. We partner with our federally qualified health center collaborators in providing and establishing medical homes for these families. So really excited to be part of this panel today.
Thank you, Dr. Cho. All right, Dr. Monk.
Hi, everyone. I'm super excited to be here, so thank you for having me. I'm a primary care pediatrician, and I've been working at Cedars-Sinai for the past 8 years. I work primarily in the outpatient setting, but do have privileges inpatient. So I spend some time seeing those newborn babies. But my primary goal is to make sure that my patients feel confident in their health. They feel like they have a health home and help to establish long-term healthy lifestyle habits. And I have a recent interest in Charles Drew. I'm precepting a second-year medical student in primary care. So I've been promoted to that task and have the responsibility of hoping to educate the next generation of providers.
Thank you. Thank you so much, panelists. So once again, just a friendly reminder, the title of our conversation is called A Shot of Prevention, celebrating National Immunization Awareness Month, because as you know, the kiddos are going back to school, college courses are resuming. So we want to make sure that we're safe. So Doctors Monk and Cho, just thinking about your career trajectory, did you always know that you wanted to be a physician? I'll start with you, Dr. Cho.
Actually, no. My first love was science, and I always thought growing up, because I love problem solving and building things. So ultimately, all the way up to college, I decided to pursue engineering. And that was really kind of where my heart was as far as my love for science and math and kind of building things and problem solving. And really, I'll save that for a later point. But college was the point at which I sort of started my path towards medicine.
Okay, I like that. What about you, Dr. Monk?
I am different. I always knew I wanted to be a doctor. I loved science. I loved math. I was in the magnet program in high school, so I did the science, math, technology pathway. I think when I was maybe, I don't know, like 5 years old, 6 years old, I kept having to see the doctor. I was quite accident prone, and I just became fascinated with medicine and that relationship with the patients. And I just knew that I was going to be a doctor at some point.
Wow. And look at you both now. So that's amazing. So with that, especially with you, Dr. Cho, I want to just talk to our students who are in the audience. And as I stated, I'm the director of community college partnerships. So to our community college students, it's okay to pivot. Right. So you have someone who is an amazing physician, but who went to school for something else. So there's nothing wrong with pivoting. All right. So, okay. Let's talk about college. Dr. Cho, what was college like for you?
College was amazing. As I noted, I pursued an engineering degree. I was born and raised actually in Alaska, and then went to the East Coast for college, Philadelphia. So went from small town to big city.
Wow.
Definitely encourage people to kind of go outside their comfort zones, explore, see what's out there. My love for science didn't change, but I found myself like working in the lab late at night alone, building things, and found that like really I'm a people person, really wanted to be involved with people, and a career in engineering, although it's very valuable and lots to contribute. And although you can work in teams, I felt like medicine was a lot more tangible. You could work with patients directly. And at that point, I started volunteering. I actually volunteered at Children's Hospital of Philadelphia as a college student. That's kind of what turned me towards a career in medicine. So
Wow, so volunteerism, all of that good stuff. I like that. I like that. What about you, Dr. Monk?
College for me was the best time ever. I went to Howard University in DC, so I went to HBC.
It's you.
You know. And then during undergrad, it was very easy to get distracted. So if there's students watching, make sure you stay focused. Remember your purpose in school is to come out with a degree. But I was able to maintain a social life. I pledged a sorority, AKA, and still maintain great grades. So I was able to go and stay on at Howard for medical school. I think that my college experience was well-rounded. I got a great education, but also I was exposed to different populations of people that kind of helped nurture my desire to give back to the community and, educate and help underserved populations.
I love it. So you guys have heard two different perspectives on college life in the pursuit of a career in medicine. So this is great. So Dr. Monk, what was your favorite class in medical school and why?
I knew that question was coming. I'm not going to lie, medical school was quite challenging for me because I was so used to having I was such a good student in high school and college that medical school gave me a little bit more of a challenge that I don't think I was ready for. I will say I really liked pathology. In pathology, you're studying the cells and looking at the different tissues under the microscope and learning how like different diseases manifested or how they presented in the tissues and the cells of each patient was just very fascinating to me. I didn't become a pathologist, which you don't really get to have much patient interaction, but just understanding how different diseases impact the body has helped me be able to explain that to patients so they understand why I'm treating them a certain way or why I'm interested in certain symptoms and then like things to look out for when I'm explaining a diagnosis to them. So
I like that. I like that. All right, Dr. Cho, same question. What was your favorite course in medical school?
yeah, I would totally echo Dr. Monk's sort of sharing of how challenging medical school can be. It's a lot of material. But it's also fun to kind of think about how you can apply that to help patients. And I think the two classes I liked the most was anatomy and physiology. Very broadly, anatomy is about structure, how your body is structured in a certain way, like the heart has four chambers. And then physiology is how the heart functions and works and how it pumps blood to the rest of your body and how it gives oxygen and sustains life. And so it's just kind of even the basics of how the body works is fascinating, but it directly relates to how we care for patients and treat disease. So, but yes, it definitely is a lot of coursework to get through medical school. That is for sure.
Yeah, and I liked how you explained A&P, anatomy and physiology. And so with that, I can actually see your engineering brain working
Yeah.
just with, just the physiology of the heart, how you explain it's like, yeah, engineer. Yeah. Yeah, that's beautiful. I love it. I love it. Did you want to add something, Dr. M?
oh, I was just going to say that was probably my least favorite because I didn't like cadaver lab. That was
Oh, yeah.
As
Yeah, that
someone
a little
oh,
morbid, yes.
yeah, yeah, yeah. As someone who did a little bit of medical school, cadaver lab, that was actually my favorite. Loved it. Loved just cutting and just it was just so beautiful. But I couldn't eat beef afterwards.
Oh.
That was the only thing. Yeah, I just couldn't eat beef afterwards. So all right. So let's talk immunizations. So Dr. Cho, you explained AMP, anatomy and physiology so well. Give us the basics of vaccines. What do they do?
Yeah, simply put, vaccine is really just a very small part of a weakened or dead germ, usually a virus or a bacteria. And we use this to help promote an immune response. So we use the vaccine to stimulate the immune system and really to help the body fight off the real infection more effectively. So we're really trying to prepare the body for a future infection that's eventually going to get exposed to, but we used a weakened form of the germ to provide that immune response.
Okay, I like that. So thinking back to my biology courses, all of that. Okay, Dr. M, what kinds of vaccines are there? I've heard dead and attenuated. What kinds are there?
So there's two main types. There's live attenuated, and then there's killed or inactivated vaccines. So as Dr. Cho mentioned, the vaccines are basically like a weakened form of a virus or a bacteria that we inject into the body. The live attenuated ones are basically you're taking the vaccine or the bacteria and you're weakening it to a point that it's still a little bit active, but it's not strong enough or virulent enough to cause enough infection in the body. So it's strong enough to cause some immune response and your body's able to form like long-lasting immunity, but it shouldn't overwhelm your body or get you sick. And then the inactivated ones are where the virus or the bacteria is completely killed and basically a shell is injected into the body so that the body's stimulated to make that immune response.
Okay, so now we've heard about COVID-19, right? And we heard a lot of the misinformation. Oh, people are being injected with COVID. Can you just quickly explain just with the COVID-19 vaccine, because I know there is a new one that's coming on the market. So either one of you, do you mind just taking that?
Sure. Yeah, we can both kind of take a stab at it if it works out. But there are many different types of misinformation regarding vaccines, and it's the reason why a large percent of the population they do not get vaccinated for any number of conditions, which is very concerning. So COVID, very specifically, the idea that natural infection is better than getting the vaccine itself. It's a hard lesson to learn to get a primary infection without prior exposure with the protection of a vaccine. And we know that the death rates and the morbidity, which is basically how sick people got landing in the hospital, without the benefit of vaccination, people got very, very sick. And I think the natural holistic kind of approach of, well, we're going to get exposed to the infection anyway. Why don't we just go ahead and go that way? We just know that you're going to get a lot sicker, and a significant percentage of the people who get exposed for the first time will actually die. And so something as simple as a vaccine will prevent those complications from happening.
Thank you. Thank you. Dr. Monk, did you want to add anything?
I think a lot of people are fearful of the COVID vaccine for many reasons. Specifically, it was developed in a time when politics were, there was a lot of conflicting information from politicians and it was heavily politicized. But then there was a lot of misinformation on the internet about the COVID vaccine, I don't know, injecting DNA into you and altering your DNA, or the COVID vaccine may actually get you sick in the end. But the COVID vaccine has been, I think, it's been so scrutinized that it's even safer. And I think that because of this, people should, be more open to it and trusting of it. But even with vaccines, all disease is not 100% preventable. So as Dr. Cho was mentioning, people think that they might as well just get sick, but the severity of that illness is going to be like more severe if you don't have that baseline protection, if your body's not primed to be able to mount an immune response and protect it.
Thank you. Thank you so much. And so, as I stated in the beginning at the top of the discussion, the kiddos, the children, they're going back to school. So, talk to us about the immunizations that the little ones should have. Let's say, pre-K, our school age kids, the little ones, not the high school ones, but the little ones.
The little kids going back to school, it depends. I take care of kids from all ages. So I think the majority of my job is vaccinating kids. The ones that we worry about as we're entering cold and flu season, I want to make sure that most patients are vaccinated against their childhood immunization. So pneumonia, whooping cough, Haemophilus influenza. All of these things a lot of people may not be familiar with because we do vaccinate against them. So they're not stricken with disease and they're probably not hearing the names as frequently, but it's cold and flu season approaching. The new COVID vaccine will come out in September, as well as this season's influenza vaccine. So I think that it's appropriate that all eligible children get those vaccines. As in addition to that, most children entering kindergarten are required to have their MMR and chickenpox vaccines updated, as well as their DTaP, which we call the whooping cough, and their polio vaccines updated as well.
Thank you. So can you tell us, for either one of you, there's a lot of misinformation also about childhood immunizations, right? Saying that, oh yeah, your child could end up with autism if you get them immunized. Can you talk to us about where that came from and why are people saying this? And please just demystify this.
There was a study, many years ago where a researcher looked at thimerosal mercury and tried to determine if there was a link with autism. And their conclusion was that there was a link. It was a very poor study, and it has since been further studies have actually debunked it. The level of thimerosal in vaccines is very minimal, and they have never found a link with thimerosal, mercury, and autism. So, ultimately, everyone wants to make sure that we don't take in toxins or things that can cause long-term damage. If there's anything that has been studied well for decades, it's vaccines, particularly the vaccines that we recommend for childhood. But it's unfortunate that one study can get into the lay press, and then there's a big movement about how vaccines are harmful, which in fact, it's just the opposite. It's been proven to be very safe. There are exceptions where kids who are really immunocompromised, kids who have cancer and are on our chemotherapy, those kids can't get certain vaccines. And so we just need to be mindful it's not for everyone, but for those of us who are healthy, we really strongly recommend it because it benefits not just the individual, but the community.
Thank you.
I think
Dr. Monk?
onto that is the study looks at children once they got their MMR vaccine and their developmental outcomes after or subsequently. And as Dr. Cho mentioned, that study was poorly designed and it was debunked, and multiple studies have been performed subsequently that have not found any link between any vaccination and any developmental delay. However, the age at which we start to recognize autism is around 12 months, when children are supposed to be acquiring these milestones and like we're monitoring skills of communication. So it's also timely that you get the MMR vaccine at 1 year old and you also start to notice these developmental delays. I think that was another reason why people make that association. But in addition to that, the amount of metals or adjuvants that are added to the vaccines, the reason why they add certain metals to vaccines is so that they are able to work better in your body. But the amount of metals in the vaccines are minuscule. The amount of metals that a child will receive from the lifetime of their childhood immunizations is less than they will receive from 6 months of breastfeeding or from formula. So in the first 6 months of life, they're getting an insignificant amount. And the way that it's absorbed into the body is not enough to cause any type of like immune reaction or get into the brain or into the like neurodevelopmental or into the neural tract or anything like that. So I think a lot of parents have concerns about injecting something into a developing body when the child's not able to speak or the child is not able to show that their full potential, and they don't know like if they're going to exhibit some signs of delays later. But these vaccines have been studied, it's been published. I think that there's so much scrutiny over the MMR vaccine that people go a step, above and beyond just to make sure that they're taking all the precautions to make sure that the vaccine is safe and effective.
Thank you for that. Thank you. That was a great explanation. And I hope those in our audience, they understand that these are myths that have been debunked. So please, please, please get your children immunized, and please get vaccinated. So we touched on this before, just with herd immunity, right? And Dr. Cho, you spoke about that, like, oh, well, I'll just get sick. Well, it's okay. I'll just get the disease. So talk to us about what is herd immunity? How does it work? And why wouldn't it work with the diseases that are out there right now?
Yeah, I mean, I think that ultimately, whether you're talking about schools or daycare or workplace, whenever you have a group of people congregating, they can spread infection. Those who are protected are those who have had some prior exposure. For children, it's in the form of vaccine. And so not only are there, and it takes a certain percentage of a group of people to get vaccinated or to have some prior exposure for the rest of the children to be protected. And for example, measles, which is one of the most infectious agents out there, over 95% of the population need to be vaccinated to prevent the other 5% from getting infected. The other 5% could be, like I use the examples of kids who have cancer who can't get the vaccine. So they are susceptible to, if they ever got exposed to measles, they would catch it and they would have a very poor outcome if they got it. So they're relying on the healthy kids to be vaccinated. And I think the school mandates of requiring vaccines is important to ensure that herd immunity. And I think this is really getting into the issue of not only is there individual benefit of the vaccine protecting you from a future infection, but it is really the well-being of the community, the school that you attend, the class that you are going to learn in, the workplace that you go to, that we have a obligation to each other to protect each other if we can. And that's where herd immunity is such an important community concept, is that we are doing it not just for ourselves, but we're doing it for people around us.
Yes, absolutely. And as a person who studied public health at Charles R. Drew University of Medicine and Science, I totally agree. We have to be immunized and get vaccinated, not just for ourselves, but for others. And in the words of former Governor Larry Hogan, wear a damn mask. Just wear a damn mask. It doesn't hurt. So, and that's what he would say, wear a damn mask. So, in the workplace and all of that is to protect yourself. But Dr. Monk, you said something that pricked my ears. And so I know as a pediatrician, you all just don't see little ones, you see not so little ones as well. So with the older kids and even with college students, we've heard about various immunizations that they should have. Can you talk a little bit more about that?
Definitely. So the college students, we've assumed they've already completed their childhood immunization schedule, but going into the dorm rooms or to places where they're in close contact, it's important that they're protecting themselves against meningitis. So meningitis is an infection that basically an infection around the brain, and it can be as serious as, the outcomes can be as serious as death. So most children are getting their meningitis vaccines when they're 11 and a booster at 16. Some of the colleges are actually requiring a booster to enter. So the requirements vary per university, but it's really important that we're protecting ourselves in any way that's possible.
Mhm. I like that as well. Yeah, and then also there are some other um immunizations that are out there. Can either one of you talk a little bit about RSV?
Sure. I was going to say, as well as, in addition to the meningitis vaccine, all of us should be getting our Tdap or tetanus boosters every decade that protects you from pertussis or whooping cough in layman's terms. And then the RSV vaccine is available for younger children. The RSV vaccine previously was available for premature babies, but there has been a rise in RSV in the community, and it affects older people or people with underlying respiratory disease. RSV stands for respiratory syncytial virus, and it's a virus that affects the airways and can cause a lot of respiratory distress and even lead to hospitalizations, especially in little babies and premature babies. But I did see a large population of just my toddlers being infected this past year and requiring hospitalization. So we are giving the RSV vaccine to pregnant women so that the benefits of the vaccine transfer to the baby so that they're protected in this cold and flu season, as we call RSV season, until May. And then we're also giving the vaccine to some qualifying infants under 8 months old.
Wow, thank you. Thank you for that. So, has either one of you seen any kind of disparities as it relates to the lack of immunizations, right? So we talked about COVID-19, and then you just said something else that pricked my ears with pregnant women. So my mind is going somewhere with that as I think of Black maternal death as well as Black infant mortality. Have either one of you seen any kind of disparities in immunizations? Dr. Cho, have you seen that in your practice?
Yeah, I mean, the whole existence of coach relates to trying to bridge the gap in the healthcare disparities that we see. Both nationally and locally, there are disparities regarding vaccination rates. For example, something as simple as the flu, which we see every year, which many dismiss as just like the common cold. Every year, 50,000 adults die from the flu. About 100 children die every year from the flu, and those deaths largely are preventable if you get the vaccine. If you look at low-income minority communities, their vaccination rates are lower, sometimes as low as 20% lower than the general population. It's really complicated because it's not just socioeconomics. It's a lot of it has to do with other issues and barriers regarding either stigma, not being able to get time off of work because they can't get the vaccine because clinics are generally open 8 to 5 and they can't go see their doctor until after their job, and so they don't have an opportunity. Some don't have transportation, so they can't even get to the clinic. And that's where working in South LA, working for Coach for Kids, we are literally a clinic on wheels. We go to them, we go into their neighborhoods. We say, if you can't come to us, we'll come to you, and we give vaccines, and we don't want that to be a barrier. And we're trying to bridge that gap. If it wasn't for the racial disparities and the socioeconomic disparity, then Coach wouldn't exist, because our mission is to bridge that gap. And I think we're doing a great job so far, but there's a lot of work to be done.
I think I'm very appreciative for Coach for Kids. Not only are you coming to the community, but you're partnering with them and letting them know that you're present and you actually have an invested interest in the health of these communities. There's a lot of generations of mistrust and medical mistrust because of the history that I'll just say African American people have experienced with the healthcare system. Not only are there increased rates of Black maternal morbidity and mortality, but there's been experiments, and like the Henrietta Lacks or the Tuskegee experiment, where Black people have been purposefully taken advantage of by the healthcare system. So I can understand why people are weary of vaccines or what providers are saying. I think that that's one of my biggest jobs is I try to level with my patients, and I make sure, and I think that this is the goal of this, is just to make sure that we are meeting people where they are culturally. We're making sure that we're practicing cultural competence, and we're just doing our best to explain things to the everyday people, like what is our experience with vaccination and why is it important. So I definitely see a lot of disparities in my patients that come in their vaccination rates. I think just being transparent, I get an email every month with my vaccination rates, and my rates versus my partner's rates. I think I have a lower vaccination rate because I have a higher population of maybe Hispanic and African American patients that I treat. So I I have the goals or some of the challenges of talking to the family members or debunking a lot of the myths that they're getting from their friends or their colleagues regarding the side effects of vaccines or why to delay vaccination. But then I also see patients that can't make their appointments or keep the appointments due to lack of transportation or not being able to get the time off, or maybe they have a lapse in their insurance, or they're not able to get childcare for another child. So there's many reasons why it's harder for some of these patients to make it to our office. There's not a lot of public transportation coming to Beverly Hills. So hopefully that's changing soon. But still, there's a lot of obstacles to maintaining your health and to completing the vaccinations.
Love that. And I really love the work that you're doing, Dr. Cho. When I worked in DC, we had something like that at Children's National Hospital. So at the George Washington University, we would link up with them, and those are things that we would do in the community. So bravo for doing wonderful work. And thank you, Dr. Monk, for your comments. So with that and answering the question. So, Dr. Cho, I wanted to back up though, because you talked about the work that Coach is doing. So, you talked about with probably like predominantly African American patients, but does Coach work with immigrant patients, right? So maybe people who are here, fleeing from something, maybe they don't have their papers, right? So would Coach provide immunizations for those kids?
Yeah, definitely. We work with marginalized communities in South LA specifically. That area of Los Angeles has the highest needs. It includes undocumented immigrants. They are some of the highest risk patients that we have because unfortunately there's a fear and an understood fear, right? That they feel like they're going to be reported, they feel like they're going to get deported. And even though California is very supportive and wants to provide healthcare for everyone, even though it's very true that no one will get reported by accessing the healthcare system, there is within the community, there is a fear of going formally to a hospital or a clinic. And so they tend to wait till they're sicker before they seek medical care. And it's definitely not good for the healthcare system. It's not good for their community. So Coach for Kids has developed a trust in the community because we go out and they say, oh, everyone is so nice and so available and so accessible, that we provide that safety net where they can come and sort of be that medical home for them where they can get their vaccine so they can go to school or whatever it is that they need. But yes, it is a work in progress because there's a lot of misinformation out there regarding care of undocumented immigrants. And they work in our society, they contribute, yet there's this idea that they would be punished if they access healthcare, which should never be the case. But we're fighting against that perception. And we're very proud to be able to provide care to that population.
That's right. That's right. Dr. King did say that just with certain cases of inequality with the inequity of healthcare is the most inhuman. So, not inhumane, inhuman.
Yes.
So thank you. Thank you for that work. Dr. Monk, can you tell us a little bit more about your practice? You stated that with the numbers that you see with the immunization rates, they're lower because you do have a higher population of Latinx and African American patients. But talk to us a little bit more about your practice at Cedars.
I work primarily in the outpatient. So as you remember, as a child, you go to the doctor for your routine checkup, but also I see people for the acute illnesses as well. So I typically see babies from birth until they go off to college at 18 or whatever they choose to do. So I do spend a lot of time counseling people about different diseases, but also preventing those illnesses. I will say I have been seeing an uptick in a lot of COVID cases recently. And I know people think that, oh, COVID, it's just a cold these days, but we still are seeing children with severe complications. I just wanted to emphasize that. I recently did have a patient with like Miss C, so which is the COVID. If you had COVID maybe a few weeks before, and now children are getting high fevers and organ dysfunction and heart disease, and elevation of their liver enzymes and having really severe illness where they're having to be admitted to the ICU. So a lot of people are saying, oh, I had COVID, it was nothing. It just felt like allergies or a common cold. The people that I'm seeing, the children that may not be yet eligible for vaccines, these are the ones that are getting those complications. So I try to stress to these people during their well visits or their routine checkups why it's important to stay up to date on their vaccines. Because as Dr. Cho mentioned, we're not just taking care of ourselves, but the families of our community as well.
Thank you for that. Yes, and COVID-19 rates, they are increasing as we've seen an uptick in activities, as the young people say, we're outside. Yes, you're outside not wearing a mask. So yes, that's why those rates are going up. Folks are at various festivals, weddings, concerts and so forth. So it's very, very important to get boosted. Folks are leaving the country. I did, but I got boosted before I left the country and I wore my mask. So thank you for that, Dr. Monk. It's very important that COVID is not over. It isn't. So thank you, thank you, thank you. So moving on, I want to talk about prevention and care. So what advice would you give to that mom who's a little apprehensive about getting her kiddo immunized? I'll start with you, Dr. Cho.
Yeah, I think it's simple. Maybe simple in theory, hard to implement for some families, but just please keep up with the recommended vaccinations that are recommended by the CDC. Like I said, we have decades of experience, and we are actually a victim of our own success. We don't see measles anymore, hardly at all. A lot of the childhood illnesses that we saw in big numbers and causing lots of harm and even children dying, we don't see anymore. And so there's a sort of false sense of security that these diseases have gone away. But every once in a while, you hear the measles outbreak at Disneyland. We have pockets of children who are not being vaccinated because their parents are like, this is no longer a problem. So, and it takes not just us as pediatricians, but really the community in large to kind of fall back on the facts and the science and understanding that it's very hard to eradicate disease. And so we have to do our best to keep up with vaccinations, prevent our children from getting affected. So this message is simple: get vaccinated. And if you have questions, please come and we'll have a conversation about it. If there is concerns about any number of reasons why your children, you fear getting your children vaccinated, we can talk through it. And that's really important part of it is the conversation.
Yes, conversation and education and empowerment.
Yes.
Love it. What about you, Dr. Monk? Anything you want to add?
I think a lot of people fear vaccines because of course, the misinformation about there being links to developmental delays. But I try to remind people that these are the same vaccines that we got as children. They're not new vaccines. Vaccines have been around for centuries. And the reason why we're sustaining healthy life is because we are benefiting from vaccine. I try to tell people, like, I've traveled around the world and I've worked in different countries, and these people would love to be receiving these vaccines, and they may not see typhus, or they may not see, I don't know, tetanus, but I've seen these things affect communities and people actually die from them. So I try to let them know that these vaccines are effective. And if they really do want to protect their child, because honestly, parents maybe are fearful of them because they don't want to do any harm to their child. But I let them know the best thing that you can do to be proactive in their health is to protect them from illness, okay? Children have a weakened immune system. That's why we're trying to prime it to allow it to develop and to fight in case they do come into contact with these viruses and bacteria later in life. So I think as parents are doing their own research, they're coming around, they bring me articles and I like to go through them with them and have meaningful conversations and not pressure them. I respect their parents' perspectives and their input, and since they are decision makers and they're educated, I just try to give them my perspective as well and be a listening ear and hopefully guide them in the right direction.
Yeah, and I would caution parents, as you are doing your research, you know, Dr. Facebook, Dr. Instagram, Dr. TikTok, that's not the way to go. You would want to look at peer reviewed articles and so forth, and really just speaking with your provider. That's something to do. So thank you for that. Just sticking in the same vein of prevention, what can schools and universities do? Because as you saw with Cedars, you guys partner with UCLA, you guys partner with us, and we had a wonderful partnership as it related to COVID and really galvanizing to make sure that our communities were vaccinated. But it seems like since COVID is kind of dwindling, just getting folks coming together to get immunized, that's also dwindled. We should have that same energy as it relates to the flu vaccine, as it relates to RSV and so forth. How can schools, universities, and a place like Cedars come together to make that magic happen again?
I think this is a great example of how we are partnering to remind people the importance of vaccination, making the information accessible, breaking it down so it doesn't feel so formal, and just having like informal conversations about it. Making sure that I always tell my friends, phone a friend. So when I get my flu shot or I get the reminders in the mail, I make sure I call my family members. But I think it's important that we are having that outreach. So having email blasts about flu clinics being open or making flu clinics on the weekend is something that we do to make it easier for people not to miss work and people to bring the whole family, to make sure we're not just providing care for one person, but also the entire family unit. Coach for Kids are bringing or pop-up flu clinics in different communities, or even I think partnering with the barber shops and churches and different staples in the community just to make vaccination more accessible.
Wonderful. And what I put in the chat is the link to the flu clinics at Cedars-Sinai. So for those of you in the audience, maybe you will see the recording. You can look up a flu clinic, go to Dr. Google. That's the time to do it. And you can Google flu clinic Cedars, CEDARS space Sinai, SINAI, former teacher, you guys. So you can go ahead and Google that, and you will have something that will pop up. So it talks about the flu, getting care, and also listing the flu clinic. So please, please, please do not wait. Go out and get your flu vaccine. So something popped up, Dr. Cho, because you said something. So I just want to backtrack just a little bit. You said that getting the flu shot, it it will prevent death, right? A lot of people from dying. Can you just break down the flu vaccine? Because sometimes on the news we hear, oh yeah, it'll protect you from blah 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 strain and this strain and that strain. Okay, but what if my strain is different?
Yeah, that's a great question. The flu vaccine is actually developed based on what happens in Australia. Interestingly enough, who knew that our public health is based on what happens in Australia? But Australia has a winter that precedes our flu season. They base the vaccine on what's prevalent in Australia. It's a prediction model, so it's not perfect. And that means that as best as they can predict, they develop a vaccine that will provide at least some partial protection against influenza. What we do know, especially for children, is that anywhere from 50 to 200 children die every year from influenza, and over 90% of those children who died were not appropriately vaccinated. So it's very clear that the kids who are at highest risk of having a bad outcome are those who are never vaccinated to begin with. And so it does take, and part of the problem is, there's been a lot of effectiveness of school mandates for vaccines, but they don't mandate vaccines for everything, including influenza and COVID. And this is maybe where some of the challenge lies, where we need to bridge that gap, is that a lot of people think that flu is just like the cold and that you can't die from it. But every year we work in the hospital, taking care of sick kids in the hospital. A lot of them end up in the hospital. They get bad pneumonia, and a smaller portion will actually unfortunately die. So even though it's not perfect, and that's an argument that people make, is like it's not 100% effective. There is no 100% effective vaccine, but partial protection could be the difference between life and death. And that is important enough for us to be able to educate and encourage families to get it. And including, we have an upcoming flu season that's coming up. Get, coaches providing pop-up flu vaccine clinics, and it'll be a great opportunity to get vaccinated.
Yes, and please share that information with us, Dr. Cho, where you guys will be, so we can share that with our audience. So that would be great.
Definitely. Yes, we have definitely at least half a dozen sites that we're visiting, and we can provide that through the chat.
Wonderful, wonderful. Thank you, thank you. So time is coming up. I mean, that was a great conversation. We still have like 15 minutes left, but still, I mean, this is good. So how can CDU, because I did say that we are partners, right? But how can we really be more intentional about our partnership with you? So Charles R. Drew University of Medicine and Science partnership with Coach for Kids. What would you need from us?
I am actually trying to get the link for everyone on the call, but it starts with sessions like this. Honestly, I think we have the same mission. We're trying to reach out to communities. We're trying to provide equal access and great health outcomes. And, it starts with education, having a conversation. We serve a lot of the same communities. And so there are definitely opportunities. We have health fairs, we have outreach, we work with your community partners. Lots of opportunities to work together. For those who are trainees, who are either medical students or other trainees, there's too many opportunities to volunteer and help out. Flu vaccine clinics being one of them. So I think it's just a matter of being intentional and knowing that we're all on the same team, that we're all trying to do our best in a very challenging environment, but if we work together, we could be more effective. So I really appreciate, Dr. Carter, even the opportunity to have a session like this to help educate and answer questions.
Oh, not a problem. Not a problem. That's what we do. You are part of our mighty lion pride, so we have to roar together, right? Dr. Monk, did you want to add anything?
I have not volunteered with Coach for Kids before. I always wanted to. I think it would be great to do some type of outreach like that. I think that when I can just relate to the medical students, every time I would see a patient in a various clinic, I would just make sure that they're up to date on their preventative medicine goals, make sure they're getting their checkups, their vaccines, the older people, their pneumonia vaccine as well. Just make sure that they're covering all bases. And if access during business hours is a challenge, then making sure that they're finding a health fair that may be able to provide these vaccines at no or low cost. Or even just going to the CVS, just reminding people that they don't have to, they may say, a lot of people come up with excuses like the doctor's office has a 2-month wait, or it's hard to get an appointment or something like that. Reminding people that these vaccines are accessible through their local pharmacies as well. And they're covered by your insurance because your insurance wants to keep you healthy. They prefer prevention than treatment. So we want to make sure that people are getting ahead of the illness.
Yeah, and actually, we save a lot of money. I think if we could build in more health equity, I think we said in public health, it would save like over $1 trillion. Right, it would save our healthcare system over $1 trillion. If we just built in equitable models such as immunizations, access to healthy food, all of those things, we could save quite a bit of funds. And that was an article written by my mentor, Dr. Thomas Levis, who was at Hopkins and at GW. So yeah, something to think about, right? Right? So we like to save money. So let's put our money where our mouth is. So as we close, one last question. What advice would you give to that person who's watching that's probably at a community college, or maybe that's in high school and is thinking, you know what? I think I want to do that. Do what you do. What advice would you give them? I'm going to start with you, Dr. Cho.
Yeah, I think, everyone has their own path, and the path isn't necessarily straight. Like I had shared, I decided to go into medicine in college, and for some, it actually happens later. They go and work another job after college, and they find their path into medicine. I'll be the first to say that a career in medicine isn't for everyone, but there's many ways in which you can help the community. But I'll have to be a little bit biased, and I know that Dr. Monk and I shared about how hard medical school is. I think it truly is a unique and really, an honoring profession to be able to really help people directly in such a meaningful way. You help patients and families not only at their best, but at their darkest moments when they're struggling with illness. And I think it's just very rewarding to be able to impact, the well-being, the health of a child. So, we don't want to discourage anyone. And I'm sure Dr. Monk and I would be more than happy to, answer questions about career guidance. We both work with medical students, actually Drew medical students as well. I teach the first year doctoring course at UCLA, and we have Drew medical students who are in my group. And I think it's just a unique field, and I would encourage anyone who's thinking about it to really, put in the work to try and go down that path. And if you have any questions, we're happy to answer them for you.
Thank you, Dr. Cho. How about you, Dr. Monk?
I would agree with that 100%. I love my job. I always knew that I wanted to be a doctor, but I'm extremely privileged to be able to work at Cedars. I grew up in Atlanta and never had no family members that have advanced degrees. I'm the first doctor on both sides of the family. So I definitely think the road was a little bumpy and challenging getting here. But what really helped me was just stating my goals. I told anyone that wanted to listen, like, I want to be a doctor. And someone said, oh, I know a person here, or would refer me to a relative or a mentor that they had. And those people are the ones that pushed me and motivated me along the way. They gave me a guidebook and just kind of helped me find research and different opportunities to keep and to increase my exposure. So a lot of times we say it's not about what you know, it's about who you know. And I'm going to agree that knowing people and different schools has been helpful. You get different research opportunities, and you just get the first opportunity at different programs that gave me more exposure. So always telling people about your goals and speaking it really helps you manifest them. And just trying to find a mentor early was extremely rewarding for me. So if there is anyone watching that wants any help, feel free to email me. It's an easy kyle.monk@csmns.org. I love students coming to shadow me. They have to get their clearance. I'm more than happy to precept and have medical students come and work with me just to get an idea of really what medicine looks like.
That's wonderful. Thank you guys. So please stay on so we can get a photo. But of course, I would be remiss if I did not shout out Charles R. Drew University of Medicine and Science. So Saturday, November 16th from 9 a.m. to 1:30 p.m., we will be hosting our Fall Discover CDU, where we invite folks from the community, high schools, community colleges to learn more about our programs. You can earn everything from an associate's degree in radiologic technology all the way to a medical degree, and as well as a doctorate in nursing. So I myself, as I thought I stated, I am an alum of Charles Drew. I graduated from the public health program. So please, please, please look us up. Our URL is www.cdrewu.edu. A lot of people forget the U, but it's cdrewu as in university.edu. And thank you so much for joining us in this installation of the Lion's Den, a shot of prevention, celebrating National Immunization Awareness Month. So I would like to thank Dr. Arthur Cho and Dr. Kyle Monk of Cedars-Sinai. You guys, it's late. I'm tired. It's late. It's 11 hours. 11 hours I've been up. So thank you, Dr. Kyle Monk and Dr. Arthur Cho, for joining us. And we look forward to seeing you, the audience, in our next installation, where we will be talking about healthy aging. Right? Healthy aging. How do we age gracefully? Is it really about the skin? No, I think it's also about the inside as well, how we treat ourselves. You know, some people say, wow, Ashanti, you're almost 50. Yep. But it's not about the skin. It's about how we treat ourselves on the inside. So thank you guys and have a good one. Panelists, stay on. Bye.
Thank you.